Thank you very much. I just ran the length of Russell, so thank you for giving me a moment to catch my breath. Mr. Chairman, I really appreciate you holding this hearing today and certainly believe it is critically important that we talk directly about the fact that government overreach and overburdensome regulation contributes to higher prices for Americans and often worse outcomes. After 4 years of the previous administration, it is refreshing to see President Trump committed to ensuring that American companies are able to innovate free from undue government intervention. Deregulation of many industries, it drives innovation. I believe it lowers cost. It ensures that the market and not the government is actually picking winners and losers. And so I'm going to start with Commissioner Meador. I want to address you with my first question. I know President Trump has instructed the FTC to investigate what anti-competitive regulations are actually undermining entrepreneurship and innovation here in America, and how both the administration and Congress can work together to actually unleash the American economy. So can you give us an update on that and let us know kind of what steps are being taken as a result of that executive order and how those efforts are going to ultimately help us have better outcomes and lower prices?
Yes, Senator, of course, thank you. So the process is ongoing. FTC and DOJ have both received a large number of comments from people across the economy and across the country highlighting regulations that they believe are harming competition, that are preventing small businesses from entering and disrupting static markets. So we are actively reviewing those. One of the benefits I think both the Antitrust Division and the FTC bring is our vast experience enforcing the antitrust laws. And this is what we do on a daily basis, is evaluate how competition works in these markets. And so that's going to enable us to review these regulations to see how they might be unintentionally or unfortunately sometimes intentionally distorting competition in those markets. And then we can inform the agencies with recommendations to say, we think these regulations are problematic. Here are ways you might consider modifying or perhaps rescind them. But then we can also provide guidance to Congress so that you as the legislative body can take steps to remedy them if necessary.
Thank you. So one of the things I want to talk to the whole panel about is healthcare cost. So when you look at those continue to skyrocket across our nation, whether it is PBM, scope of practice, generic drug manufacturing reforms. Americans are tired of paying more and getting less. And when it comes to healthcare, it is my belief that Americans deserve better. In my view, a massive part of the problem of our healthcare system is that the government refuses to get out of the way and let our healthcare providers adapt to ways to better serve their patients. And time again, I feel like the data shows that when the government deregulates various industries, innovation skyrockets and we do have better outcomes. So if we could just quickly go down the panel, what government regulation do you see that you believe contributes most to poor outcomes in our healthcare system, and what reforms could Congress adapt to ensure that our patients can receive and providers can actually provide quality, affordable care, particularly in rural and underserved communities? So we'll start with you and then just head down.
I think you're exactly right to put the spotlight right on healthcare as a space where both private and government interventions are reducing output, driving up prices, lowering quality, and really harming patients and those who pay for care through their insurance premiums. Here are a couple of highlights. Thing number one, across the country, in something like 2/3 of states, certificate of need laws require federal bureaucratic permission before a hospital or a healthcare provider can enter the market or expand. For decades, under both parties, the FTC and DOJ have been screaming about how these laws demonstrably drive up prices, lower quality, harm patients in exactly the way that you're describing. Worse still, they were popularized by a federal congressional mandate in 1974. It's time to put that engine in reverse and incentivize repeal of certificate of need laws. Number two, certificate of public advantage laws. Congress owns and controls the federal antitrust statute, but the Supreme Court has given for decades state governments the power to immunize private mergers, including hospital mergers to monopoly. These certificates of public advantage, time and time again, work demonstrable harm on patients' access to healthcare and the prices they pay for it.
And
Congress should close
Professor
that loophole.
Francis, I am so sorry, but I am almost out of time. So if we can quickly get to your third, so that
Sure.
if there, we will have to do like a lightning round if the chairman is so gracious to allow that.
I can hit the third in one sentence. Right now, if you're a branded drug owner, you can throw a patent in the Orange Book without any review from the USPTO. We should let the PTO check that's not being abused.
Thank you. Was it my running here that gets me this additional time?
Listen, we've been playing fast and loose all afternoon.
They're going to give you all my time, so go ahead.
A bunch of us had planned for that 4 p.m. briefing this year, which apparently has been canceled, so we got more time.
Thank you so much, Mr. Chairman.
And I'll defer to my fellow panelists, but I'd like to come back if there's still time. But I'll let those with expertise in this area answer you.
So as Commissioner Meador mentioned, the deregulation task force at the FTC and the DOJ are focusing on a whole variety of different healthcare issues. The comments, over 400 comments that have come in, almost half of them have been related to healthcare concerns about regulatory burdens associated with that. And that includes not only at the federal level, but also at the state level. So Professor Francis has been talking about certificate of needs at the state level. There are a lot of problems at the federal level as well, and a lot of the comments have come in related to that. So, you know, lower cost treatment options, like nurse practitioners and nurse anesthesiologists, there's restrictions on that. Rules that prevent physicians from owning medical facilities, site of care restrictions, you know, the whole variety of things. And so as part of this executive order, we're collecting all of that suggestion, and then we're trying to prioritize the ones that we think are most likely to be the most beneficial to the average American consumer, and then we're going to be working with cooperative agencies to try to see if we can revise some of these regulations. So that's basically the answer that I would say at the federal level.
Thank you so much, Mr. Alford.
Senator, thank you for asking the single most important question in antitrust right now, which is what to do about healthcare. There is no bigger cyclone and convergence of private regulation by monopolies, bad public regulation, and the platformization of healthcare after years of unchecked mergers and serial acquisitions in this space. And so this is a time not to focus on sort of ticky-tacky sort of process deregulation, but to rethink the whole regime because the problem is so bad. I was alarmed to read a report recently that in Connecticut, I believe, there was a national security brief that described the healthcare crisis as a domestic security crisis. And so here we can do things like what we did in the Biden administration, which is make hearing aids available without prescriptions, and to our friends at the FTC sent warning letters to pharmaceutical companies to bring down the cost of inhalers and things like that. But here, I mean, legislation has hastened vertical consolidation that allows, and again, this is well-intended regulation. It's Obamacare. It's the most substantial piece of legislation we've had in healthcare in a long time, and it does many good things, but there's also some hidden pathologies, right? Circumvention of the medical loss ratio, the ability of the biggest behemoths to essentially pay themselves. And so my former boss, Jonathan Cantor, was really fond of saying, back then when people said single payer, we all thought we were talking about the government as single payer, but pretty soon we're going to have maybe a different kind of single payer system, right? Living under the tyranny of a very big health insurance giant that seems to own everything.
Mr. Chairman, I just want to lodge a complaint that the Democratic witness said the best question of the day was asked by a Republican senator. I mean, that is something that just should not be tolerated.
Fair enough. Fair enough.
Thank you, Senator. I would echo the comments of my fellow panelists and just add that there's a role for the FTC to continue to play in enforcing the antitrust laws in the healthcare space, especially around regulatory evasion and manipulation. I think there's a lot to address in that.
Well, guys, I appreciate it more than you know.
Senator, I'd like to comment and get as close to the mark as I can from the cattle and sheep industry's perspective. But the United States has always held a standard that foreign meatpacking plants in foreign countries had to meet the identical health and safety standards as we do in the United States. However, after we entered the World Trade Organization, first thing we did was relax the standard requiring foreign countries to have food safety standards at least equal to the United States. We relaxed it to where now the standard is close enough. And as a result, these foreign countries need only have standards equivalent to the United States. That's why when we say the beef in the United States is the best beef in the world produced under the best of conditions, we can prove it, and that deregulation of the regulation that once protected consumers is non-existent. Recall in 2017, we had to close the border to Brazilian beef because they were sending tainted beef around the world. So there's a food safety issue that affects America's health, and I just wanted to add that. Thank you.
Thank you. Mr. Chairman, thank you. And Mr. Vice Chairman, thank you